Good evening, everybody. I welcome you all to this EIZOC ORPI session 6. We are going to have the 6th session today. Basically, after discussing a little bit about research and publication, now the most important thing is in which journal to publish. So you have to select appropriate or right journal to publish your work. So how to select the journal? We will have this discussion today, and the speaker is Dr. Natasha. And I welcome, I request Professor B.N.R. Subudhi, our Chief Coordinator, to start the program.
Okay, thank you, Dr. Patnaik. Let me share the screen first. Sorry. No. Is it visible?
Yes, sir.
Right. So, once again, I welcome you all to this our program, the upcoming research and publication initiative program. Is session 6. Till date, we have already finished 5 sessions. Today, there is a very interesting session. So, many times, our students, our faculties, they get confused because the number of journals have increased recently, and it's very difficult to choose which one is good, which one is bad. So, I think today's speaker, Dr. Natasha, will tell us how do we select a good journal for our work to be published. So today we have with us, I think, our mentor, Dr. Chaitra Jaydev. She is, as usual, she is always with us in this program in the past few years, I would say 2-3 years. And along with me, our Chairman Scientific Committee, Dr. Savasaj Patnaik, and Dr. Santosh Mahapatra, our coordinator for this program. So today's speaker, as I told you, Dr. Natasha Das is not new to us. She is with us in all our ORPI programs. And to tell briefly about her, she is the co-founder and director of EIZOC Consultancy Private Limited, a healthcare communication service provider. She is an alumni of SC Medical College and Hospital, Cuttack. She has over 22...
Slides are not moving.
Not moving?
No.
Let me see. Now it's okay?
Yes, yes.
So, Dr. Natasha Das is the co-founder and director of EIZOC Consultancy Private Limited, a healthcare communications service provider. She is an alumna of SC Medical College Hospital, Cuttack. She has over 22 years of experience as a medical writer, reviewer, and a trainer, and spoken on health communications and medical writing at various institutes and Indian and international conferences. Dr. Das has published research papers, review articles, textbook chapters, books, and blogs in different aspects of medical writing. She is also a peer reviewer of several Indian and international journals. Her article, Plagiarism, Why is it such a big issue for medical writers? Has over 115 citations and is also cited in the International Good Publication Practice, that GPP3 guidelines, which are prevalent from 2015 to 2022. And now GPP 2022 was launched in August 2022. She is an active member of the Medical Writing Council of Indian Society of Clinical Research and has been designing and conducting several scientific writing workshops for ISCR. So welcome, Dr. Natasha Das. We will be listening to you how to select a good journal.
Thank you so much, sir, for the kind introduction.
And today's moderators, our own Dr. Prafulla Maharana is the faculty in AIMS, Delhi. And along with him, 2 more moderators today we have Dr. Rolika Bansal. I think Rolika also is well known to us. She is working with Dr. Santosh Sanabar. She's a fellow of oculoplasty in CFS, Hyderabad. And she's actually, of course, from Karnataka. She has numerous publications and she has got a lot of writing experience. And she will also be, along with Dr. Prafulla and Dr. Chandana Chakravarti, she will be guiding us. And Chandana Chakravarti is also not new to us. She is from Bengal. She is from RIO. She is a professor of ophthalmology at RIO, Kolkata. And today's panelists being Dr. Sharmishta Behra from Vimsar Burla and Dr. Pushpa Kumari from IGH Raurkela. Of course, today's discussions, they are from different institutes of eastern states. Dr. Prajna Paramita Meher, Dr. Aishwarya Bhakta, Dr. Jaydev Nanda, Dr. Tarun Baksala, Dr. Anjani Agrawala, Dr. B. Pravina, Dr. Pratibha Behra. So I request all these discussions, the postgraduate residents to ask questions. Just listening is not very important. Unless you ask questions, we will not know whether you have understood the topic or not. So please be active, interactive with the speakers, moderators, panelists. So with these words, I welcome all the viewers, all the faculty, all for this ORPI session. So thank you very much. Now I hand over the mic to Dr. Chaitra to say a few words before Dr. Natasha takes over. So it's over to Dr. Chaitra.
Hi, sir, and thanks for doing this session. I think it's a very, very important topic because even till today, I can't decide, which paper goes to which journal and which is most suitable for it. Besides the fact that we have so many different journals, there are many factors actually, which I'm sure Dr. Natasha will elaborate on. And one of the most difficult choices to make is open access. And if it is open access, whether it is paid open access or not, whether they accept case reports or not. So it's so difficult, and I'm sure she's going to make it all easy for us to understand how to make those choices and what are the tools that are available, to actually submit probably an abstract, which will then pick out the keywords and tell. There are several online tools which can help us decide. I'm sure Dr. Natasha is going to tell all of that to us. Thank you, Dr. Natasha, and I can't think of a better person to do this talk given your experience and expertise in the field. Over to you, please.
Thank you, Dr. Chaitra. That was too kind of you to say such nice things about me. Let me just share the screen and then we can start off. Please let me know if you can see the screen.
Yes.
Is the screen visible? Okay, thank you.
Yes, yes.
Yeah, so this has already been discussed by Dr. Sudhi, so I'll not go into details of this. This is just a disclosure that needs to be there on all my slides. So like Dr. Sabyasachi said, there are so many journals being published every single year. So as for some publications, there are around or more than 34,000 journals every year. Now, looking for the right journal for your study might be as if you're looking for a needle in a haystack. But from which direction should you look for that needle? How do you look for that needle? What are your what are the points you should consider? That's what we're going to discuss today. First of all, I would like to know from the students here, why do you want to be selective about your journal? What's the point? Of course, you should be selective, but why? Why should you be selective about your journal? Anybody who has a point to discuss, why do you select your journal? Why can't you just send it to any journal? It'll be good to have an interactive session, so I thought I'll put across a question. Yeah, please go ahead.
Ma'am, so that the work which is done, it is highlighted and it is known to the persons which you want to explain, or the work what you have done, that is highlighted in the best of the possible way.
Widely.
Yes. Very true, Dr. Agrawala. Any other point that you look for when you are looking for a journal? I mean, why do you need to be selective about the journal?
Also, ma'am, better chance of selection.
Selection as in
When you will,
acceptance of the article,
yeah,
right?
acceptance.
Okay, okay.
In
Yes.
every journal, your work might not be accepted.
Yes, that's true. But
I would look for a journal with a target audience. So if I've written something that I would want a journal where I'm sure that the readers would be interested in the kind of work that I do at this point of time, rather than a journal which will just select my paper because it's good or bad. But I want to actually disseminate the knowledge. So I guess what Dr. Natasha is probably also trying to say is at different stages in our career, I think we would want different points, and each one of us from at a student level and probably at a slightly more senior level, we're looking at different reasons about why we're selective.
yes, absolutely correct, Dr. Chetha. So sadly enough, most researchers these days are looking at just the NMC guidelines. Yes, those are important. You have to take those into consideration and then look at the bigger picture, because research does not end with the publication. Just publishing it in any journal that will accept your article is not the end of the story. Why you are publishing? You are publishing because you have something to say, you have something to communicate to the scientific community or to practitioners or to the patients. So depending on who your target audience is, you have to look for the right journal. And your article would be a reference source for other researchers. It will help identify gaps or expand, people can expand on the knowledge that you have shared. And it will lead to more inventions and innovations, new drugs, devices, and therapy modalities will be in use. And that ultimately will lead to a healthier society, right? So again, the cycle continues. Once we have some drug which is newly produced, then that will be again researched upon, and then it will create another reference source. So that cycle continues. So never think that once you have one study and you have published it, that's the end of the story. It's not. Right. Now, when do you choose your journal? When would you ideally choose your journal? Anybody who wants to talk about it? Anybody from the discussants? Any of the students who would like to say when would be the best time to choose your journal? So the best time is as early as possible in your research cycle. If you're planning a research, the best time would probably be before you plan your research. You know who your co-authors are going to be and what the priority of the team is going to be. Accordingly, you can plan your journal. But as soon as possible. So in between, when you've started doing a research and you find your findings suggest that you should change the journal that you had in mind, you may want to do that. Right. So as soon as possible, try to choose your journal. Now, create your own shortlist first before even looking at, any journal selector websites or anything. So create your own shortlist. How do you create your own shortlist? It's just like buying a new car. So depending on your requirement, you choose whether you want a big car or a small car. What is your budget? Do you have the money to pay for the APC? Right, or the article processing charge? What is the requirement that you're looking at? Right. So what is the reputation? What's the brand of the car? Accordingly, what is the reputation of the journal that you want to publish in? Do you have a reference from a friend or a colleague who says that this journal is a better journal for the type of study that we are doing? So yes, that could be one point. After doing this, what do we do? We use the filters when we search in Google or at Amazon. If you're shopping for something, you use filters, right? So accordingly, find out your priorities and use filters to shortlist and find out around 4 to 5 journals that you think are best. And then it will be easier for you to focus on those 4 or 5 journals, and out of those, find out the best journal most suitable for your article. Otherwise you'll be looking at thousands of journals and not knowing where to publish, because there are hundreds of even ophthalmology journals across the world. So just thinking that, you should publish in an ophthalmology journal may not be enough. Consider your study. Most important is, what is your study about? What type of article are you publishing? What is the topic? What is the timing that you're looking at? Is that study a temporal study? Like if you were doing a study on effects of COVID on the eye, you would want a quick publication, right? You wouldn't wait for a journal. You wouldn't submit to a journal that takes a long time to publish. So what is your study about? What is the timing it is looking at? And what is the key message that you want to convey? Who are your target audience? So, right, it's a good habit to write down the key message on a piece of paper. When you write down the key message, it's more clear to you, and you can then decide, yes, my key message is for this key audience, and accordingly you can choose your journal. For example, let's take an example of, say, retinoblastoma, for example, right? Now, an article on retinoblastoma, depending on how focused it is and what the study is about, you may want to publish it in an ophthalmology journal, a general ophthalmology journal. You may want to publish it in a retina journal. You may want to publish it not in an ophthalmology journal, but in an oncology journal. So you have to look at your study and always be very honest about your study when you are judging your study. Is it of the quality that your target or journal would accept? Be realistic. If you think, no, this journal may not accept the study that I have done, I may want to look at a journal where the acceptance rate would be higher, right? Also look at the strengths and limitations of your studies and be fair to yourself. Don't always think that there are too many limitations in my study and this is not qualified. Like I am an Indian academic student in an academic institute, and my study may not qualify for say ophthalmology or for eye or for that matter for Lancet or any gem. It's not like that. There are lots of good articles coming out from India itself. So don't be too critical about your study. Look at the strengths as well as the limitations. So also consider the priorities of the organization that you work for, the research team that you're working with, the study, and at your own priorities for promotion or whatever, and then think of the right journal. Together you have to consider everything else and also your own priorities, and then choose the right journal. Now, these are some of the things you may want to consider while choosing a journal. The scope of the journal. What type of articles does the journal accept? Does it publish articles in English? What is the peer review process? Are you comfortable with a journal which has an open peer review system? Indexing database, right? So which database is it indexed in? Is it indexed in Medline? Is it indexed in Embas or Scopus, or is it indexed in Doage? You have to look at what your requirements are and see if it is actually indexed in those databases, and then choose your article. Publishers, country, chances of acceptance or rejection. How do you find out the chances of acceptance or rejection? That is mentioned in the about the journal page of the journal website. So you will find a mention that, let's take AnyJam. AnyJam has just a 5% chance of acceptance. So 95% of the articles which are submitted to AnyJam are rejected. So do you think you qualify in those, in that 5% of the articles which are eligible for acceptance? Then go ahead and publish, submit there. Or are you looking at an journal which has a higher chance of acceptance? There are journals which have more than 50% chances of acceptance also. So you may want to look at those. Periodicity. Is the journal publishing once or twice in a year, or is it a quarterly journal? Is it a journal that publishes maybe every month, every week? So a journal that publishes more often requires more number of articles. So the chances of acceptance is more, you would think, but it's not like that. Lancet receives huge number of articles and is published quite frequently, and yet the rejection rate is quite high, right? Look at the response time of the journal. How quickly will they respond with a peer review comment? What is their usual peer review cycle? Do they complete the peer review in say about 2 months or 3 months, or do they take about 1 year to complete the peer review? Where will you find that? That will be available either on the journal's website. They may mention themselves that, this is our response time. Or if you can see some of the recent articles published by that journal, on the article PDF itself, it is mentioned when the article was submitted, when it was accepted, and when it was published. So you could look at that. Look at the instruction to authors and see what is the word count of the, limit of word counts for the article, limit of word counts for the abstract. How do they want the abstract? So IJO, I believe, has an abstract limit of 75 to 150 words, I think, right? Or 75 words. I'm not very sure. It has a very small limit of word count in the abstract compared to many other journals which may accept an abstract of 300. Sorry. There is some background noise. Yeah. So compared to some other journals which may have may allow you to write an abstract which is 300 words. How many references do they allow in an original research article? Some journals have a limit, some journals do not have a limit. What are the number of table and figures that they will allow? Some journals have a limit of about 3 tables or maybe 4 tables. Some journals have a limit on the number of rows or columns in a table. They do not allow you to have long tables in the article. So you have to look at all those things, and depending on your study, if the requirement is to have a longer table, you may want to disregard a particular journal and select a separate journal, right? Then when you're looking at word count, also look at the IMRAD distribution that those journals ask for. Some journals want a very short introduction. Some journals are okay with longer introduction. So if you've already written the article and are now looking for a journal, you might have written an introduction which is very long. And now to compress that into 75 words may be a challenge, right? Look at their data sharing policies. Do they want you to share all the raw data also? Where should your data be shared? Is there a specific, website where they want you to put your data? Or some journals allow you to just write a data sharing statement saying that, the corresponding author can share the data on demand. That can be also an option. Does your journal ask for multimedia of surgeries that you've done, maybe a video abstract of the surgery that you've done? Then you will have to have that video, right? If you've not had that video, you may not want to submit to that article, to that journal. Then does the journal ask for a plain language summary? If it does, then you may have to rewrite your article or write another plain language summary for the particular journal. Look at the APC or the article processing charge. How much is the article processing charge? Is it within your budget? How is that APC being used? Is it only during submission that they want, or they want it after acceptance only? They will not take it at submission, right? What is their policy regarding preprint? If you've already put your journal on a preprint server and now you write to your article on a preprint server, and now you put your article, submit your article to this journal, they may say that, since it is already on preprint, we don't want your article, and it will get rejected. So check that. Some journals, some journals in the BMC group for all authors to have an ORCID ID. So if you don't have an ORCID ID, you may either want to create an ORCID ID, or you may want to not send the article to that journal. You may want to send it to another journal. Look at the target audience. Is it, say, like if it's an article on TB uveitis, right? You may want to consider a journal which is focused on UVI diseases, a journal which is on ophthalmology diseases, a journal which is on infectious diseases, a journal which is focused only on respiratory diseases. Then you may want to also focus on a journal which is into public health, right? So you have to see who your target audience is based on your study. Then look at the accessibility of the journal. Is it on open access? What kind of open access? Hybrid open access means they will not give open access to the article at publication, but there might be an embargo period of say 6 to 12 months, after which it will be available at free open access. Or is there a paid open access facility where you pay for the article to be open access, right? Impact factor, yes, that is important, but I have put it at one of the last points because it's really not the most important criteria for impact for choosing your journal. It's one of the criteria. Once you have decided on a couple of journals, you may want to compare one to the other and see which has a higher impact factor, and accordingly you may choose one journal which has a higher impact. Look at journals and see if they are only available online or they have a print versions also. If that is important for your organization, you may want to consider that. Now, other points to consider: when did the journal start its publication? Is it an old journal or a new journal? Because the issue with some new journals is some journals, even if started by very good publication houses, like there are some journals by Springer which were started in 2016 and have phased out in 2020. Just 4 years is the lifespan of that journal, right? So see when was the last issue published. Is it publishing regularly or not? I will share with you one example of personal experience. This is from the NMJI, or the National Medical Journal of India. We submitted this particular article in April 2019. Though it was published in one of the issues of 2020, it was actually published only in January 21. So people had no access to this article before January 21. And this article was about MCI's recommendations on authorship sequence and all that. Now, by the time this article was published, MCI had already been dissolved, and this article was actually not so relevant, right? So you have to look at your study and look at how regularly that particular journal publishes. Is it publishing on time or not? And yes, NMJI is a reputed journal, and yes, we've got citations for this article also. But now this is not so relevant. If you look at the timing of the publication, it matters, right? Now, one thing to remember is pay and publish journals are not necessarily predatory journals. If you look at EIZOC also, for example, EIZOC is a free open access journal, but if you want some of the figures to be in color print, you have to pay for that, right? Look at British Journal of Ophthalmology. Now that charges close to 3 lakhs for open access. 3,000 GBP is what they charge for open access. And if you want a color photo, it's another 400 GBP for a color photo. There are some journals, like I mentioned, like Ophthalmology Journal, where you pay 3 lakhs, then you get an immediate open access. If you don't pay that 3 lakhs, you have to wait for the embargo period of, say, 12 months in the case of ophthalmology. Now, what are predatory journals then? We have heard a lot about predatory journals. Now, there is, till 2019, there was no consensus definition of what is predatory journals. Some called it fake journals, some called it predatory, some called it bad journals, some called it pseudo journals. In 2019, a group of researchers from 10 different countries decided that this is going to be the definition of predatory journals, where the journal is prioritizing self-interest at the expense of scholarship. And how does it do that? By providing misleading information, by deviating from the best policies for editing and publishing. And there is a lack of transparency of how they do their review or editing. And there are aggressive and indiscrimination solicitation of articles. So they keep on pushing you to send articles. That's also a criteria for predatory journals. Now, why should you not publish in journals which are possibly predatory journals? One is definitely the cost that is involved because they charge you to publish there. The other is reputation. If you have published in a predatory journal and later that, I mean, if you obviously do not go to a journal that is recognized as predatory, you may publish in a journal and then that journal may be categorized as a predatory journal. And then it affects your CV and also your promotion. Like I said, some journals may phase out, they may just stop publishing, and their website also may become defunct. I've seen this happening in the case of a few doctors from India. They publish in a particular journal and suddenly the journal disappeared. They could not, the publishers could not run that journal anymore. And there was no archive of the article that they had published. So nobody can cite it, nobody can access it or cite it, right? Some reputable citation systems also delist journals which are recognized as and pointed out as predatory journals. They also delist publishers, predatory publishers. Now, like I gave you an example of a Springer journal, which was phased out within just 4 years. So just don't go by the reputation of the journal. That's one part, but you have to do a cross-checking on your own. Now, what happens with predatory journals is sometimes they do not have a very stringent peer review system, because of which poor quality articles are published, and these poor quality articles contaminate science with citations, and they may be used in meta-analysis and may affect the policies also. So it's a contamination of science. Now, this is one example of what the journal website claims. I took the screenshot today itself. This is a journal website which says it is indexed and abstracted at NCBI NLM catalog. That's the only thing that I checked. I did not check anything else. Now, when I went for NCBI NLM catalog, this is what it says, that the journal does not provide access. The NLM does not provide access to this journal. It is not currently indexed in Medline, and it is not in the NLM connection. So even if you see certain claims in the website, do double check with the databases. Now, some red flags for predatory journals. Look at the journal name. Is it unheard of in your field of study? Does it mimic other journal names? Like one journal may be named Nature, another journal may be named as Nature Medicine. Now, Nature and Nature Medicine are not the same, right? So, but you may think that they are from the same publishers. So, or there is another journal called Natura also, which looks very much similar to Nature, but it's not Nature. Natura is a different journal, right? Now, journal website, look at the journal website and check for language, grammatical errors, how are the images, do the links work, what is the location of the journal publishers, and do they use enticing languages to attract authors to publish there. Then look at the journal articles published on that website. What is the quality of journal articles that they select for publication? Is there a regularity of publication? Look at the past issues and see that. Do they have an archive of past issues? That's the first point. Or they have only the current issue published there. What is the submission process they have? Do they ask you to submit it online or offline or both? Either ways is fine, but you need to check what is their rate of response, how much time do they claim for peer review and publication. There are some journals which claim that they can publish your article within 24 hours. And I have seen some of my, some of the doctors in my circle publish in journals which tell them that they'll publish in 24 hours. Those articles have been published in 24 hours. And then those journals have phased out because they were predatory journals, right? And then this is another screenshot from another journal. Look at the scope of this journal, from accounting to ophthalmology to management. They have everything in their scope. So there is no focus in this journal. This journal just wants to make money out of publication. Right. Should you look at impact factor? What is impact factor? Impact factor, like I mentioned, is important only after you have already selected a few journals. Look at impact factor. Impact factor is the average number of citations to recently published articles. This is only of relative importance when you've already found a couple of journals that you want to publish in. Now, if you're looking at 2022 impact factor, it is the cited score in 2022, number of citations in 2022 of items which were published in 2020 and 2021, that divided by total number of citable items published in 2020 and 2021. Right. Now, journal impact factor never stays constant. If you see here, there was a time when the journal impact factor of Nature was going down, then it rose, and now it is rising. Then there is another journal where the rise has not been so steep, but there is a constant rise, right? Now, the most common impact factor that we use in the scientific community is the Clarivate Analytics impact factor, formerly known as a Thomson-Reuters impact factor, right? We have to remember that this impact factor does not allow you to compare journals between different fields, because the impact factor may vary depending on the field of the journal, right? So if you're looking at a journal from ophthalmology field, you would like to look at impact factors of ophthalmology journals only. You don't want to compare that with a journal of the dermatology field and say that, this this journal has a higher impact factor than other journals. That's not how it goes, right? And it does not evaluate the papers or the researchers. Impact factor does not give you any indication of the quality of the papers published there or the, reputation or quality of the researchers. It's just a measure of the citations of the previous 2 years, right? Now, small scale academic journals may not have a high impact factor, right? But they may actually be very good journals. They may also be reaching out to the target audience that you are looking at. So do not disregard small scale academic journals. We all know that we tend to cite review articles more often than we cite original research articles. So even if there is a lot of good original research published in that journal, the impact factor may not be very high. Review articles may be cited more often. And then self-citation also may affect the impact factor of a journal. Some researchers may get into research misconduct by excessive self-citation, because of which the impact factor of a particular journal may increase, right? These are the reasons why you should not look at only impact factor. Now, there are some other journal metrics also. We'll not go into details of that. There are other journal metrics also. When you're looking at different journals, you may want to consider whether the SJR is high of one journal vis-a-vis other journal. Now, this is one article I wanted to talk about. This is an article we had published in 2011. Now, this particular journal is still not indexed in PubMed. It is included in PubMed. So, articles, some articles are submitted to PubMed by the publishers. This particular article is the article that has received a lot of citations. Now, it does not have an impact factor so far. This journal does not have an impact factor. So don't go after impact factor so much. If your article is good enough, it will be noticed wherever it is published, but just look at the peer review process and what your organizational requirements are. Each article, like I mentioned, is different, and it may have an ideal target journal. So your team may have certain priorities, you may have certain priorities, your study may have certain priorities. So impact factor is not important. Now, if a journal says they are indexed in DOAJ, do not believe them. Go to the directory of Open Access Journals website and check if they are indexed or not. Right. This is one screenshot of an email that I received, and I'm sure many of you are receiving emails from different journals. This is an old screenshot, of course. This is about the MCI norms. Nowadays you receive about the NMC norms. They said they will publish in 3 working days. Now, people here who have been reviewing articles, they can tell you that 3 working days, it sometimes takes us more time to just review the article. We are unable to return articles within 3 weeks when the journal asks for us to return the articles in 3 weeks time. So it takes time to review. A good review is what will give you a good citation also, irrespective of where you publish it, right? Now here, if you see, they are saying they are indexed on leading international indexing agencies. Now leading, just see, do we have anything here which is as per NMC rule? Nothing, absolutely nothing here works for the NMC rule, right? So you have to check what they're claiming as their indexing databases. One important resource is go to thinkchecksubmit.org. Think, are you submitting your research to a trusted journal? Is the journal right journal for your work? How can you be sure the journal you're considering is right for your research? Check. What will you check? These are the things they will provide in the checklist of that website, right? Different things. I'll just go back again and show you. Do you and your colleagues know the journal? Have you heard of the journal? Can you easily identify and contact the publisher? Is the journal clear about the type of peer review? Are articles indexed in services that you use? Is it clear what fees will be charged and when it will be charged? Do you recognize the editorial board? Have you heard of any of the editorial board members? Is the publisher a member of any of the recognized industry initiatives like COPE or DOAJ or OSPA or INASP's journal online platform? So you have to check all those. This is available on that website. And then you submit only if you can answer yes to most of the questions on the list. So go to Think, Check, Submit. This is thinkchecksubmit.org, and there are some other resources that I have added here: Bales criteria, DOAJ criteria, WOMA position statement on selecting journals. Then UGC CARE guidelines is a good source where you can see, for academic articles, which are the journals which are considered as approved journals by UGC. Now, a short disclosure here. I run a company which is a publication support service provider. So one of our paid services is customized support to select the right journal for your research. And I would like to add here what Dr. Chaitra had mentioned early on, that there are some tools which you can use to select the right journal. But I am not too sure how secure those tools are. Like some publishers will ask you to submit the manuscript or the title or the abstract only. And they will suggest few journals from their publication house. So that actually limits you to, like, if you're looking at Springer's tool, then you are limited to only Springer's journals. If you're using Elsevier's tools, you are limited to Elsevier's journals. So I personally do not prefer to go use any of those tools, but that's up to you. I'm ready to take any questions. Thank you very much for your patient hearing. We have half an hour for questions, so I can take questions. Let me stop sharing so that I can take. Usually we have these sessions for 1 hour and
Good that
We have a lot of panelists and moderators. I think they will be discussing on this topic.
Yeah.
So no problem. So I think students, they come forward. Anybody, anything want to know? Now we'll listen to Dr. Rolika. Your comments?
Yes, sir. Ma'am has very explicitly explained each and every aspect. And ma'am, as you have mentioned, and in fact, I think you have covered it in pretty much details for all the postgraduates as well as consultants to understand it. And as you have highlighted, predatory journals has become a trend these days. I think right now itself, I check my spam, there are at least 10 emails that I have, which I have to filter. And as ma'am has said, they're very similar names that they target as. So the names will resemble the closest journals. So you have to be very smart about looking at, which journal is actual and which journal is not. Unfortunately, the trend has become so these days, but ma'am has highlighted it pretty well that we have to be careful. We cannot just submit it, and they actually land up telling that it's for free and it will be done within 3 to 5 days, but it's not so. The review process does take a lot of time, and good journals actually need a review time. They don't need a very long review time, but you of course require, because it's a process that the particular article has to go through. It cannot be done so quickly.
Thank you.
Can we go to our panelists? Any of our panelists are here?
Dr. Pushpa Kumar is the panelist. Dr. Pushpa? Are you there? Yes.
Sir, good evening. Good evening, ma'am. Your comments, please, ma'am.
This is a very good, very well explained.
Very, very well.
Nice. But it is very difficult how to identify the predatory journal because it looks very similar. So we have to be a bit careful.
Yeah, sure. So like Dr. Rolika mentioned, you have to double check the website and see whether the names are very similar. That is one point. Another would be go through the website and see, do you really want to publish in a journal which does not have an editing process for its website content itself, right? Okay. So if the website content is not fine, I don't think I would go to a journal like that.
And the irony is that even when you go to their website, even the website looks pretty much like, okay, yes, this is a genuine journal. So we do get stuck at times. And I have my friends who are actually messaging, they message and they ask, because some of the friends, they have to have a research, like many of the consultants, in fact, in many colleges, they have to have at least 1 or 2 publications or like, n number of publications for the advancements of promotions. So my friends who are not interested in research, they would land up asking me that should we go for a paid journal or should we, just submit and wait? What do we do? So what would be your suggestions for them?
Yeah, so like I mentioned, paid journals does not necessarily mean predatory journals, right? So even IJO, which is so much reputed in this field of ophthalmology, charges for colored prints, right? Or if you look at British Journal of Ophthalmology, it charges you 3 lakhs for just publishing your article in open access. So that doesn't mean it's a predatory journal. There are some costs that have to be borne because of the process in which a journal runs. So one has to pay. If the authors don't pay, the readers have to pay. And if the readers have to pay, there will be limited readership. So in that case, the authors have to pay, right? So when the authors have to pay, they have to look at what budget do they have. There are some journals where you can write in for a waiver also. You can give a valid reason for a waiver. And they will accept a waiver. And if they think that, yes, this is an article that we want to publish and we will not let this article go to another journal, we would rather waive off the fees. So that they do. Yeah.
Yes, ma'am. Actually, you've highlighted a very important point, and especially for postgraduates. In fact, even I have once written similarly to a journal. You can actually request them that you're from a developing country, you are a postgraduate, and you cannot afford the journal fee, and it's a very good journal, so you would like to submit the article, and if it is selected, can they waive off the fee? So the particular journal that I applied to, they actually replied very nicely and say they reduced it to 75% of the cost. I still couldn't afford that. That is a different matter. But of course, like, they are responsive enough that they help out as much as they can. So that is one very good thing for us to learn.
And some journals on the website suggest funding agencies who can fund for your publication.
Yes.
That is also there.
I have few questions.
Yes.
Yes.
Chandra madam.
Hi, yes. First, I want to congratulate Dr. Natasha Das. It is really, really brilliant talk. It's very nice.
Thank you.
So means lucid and so helpful talk. Nowadays, the PG students, they are also supposed to have one publication. That is there. But I think these PG students actually, they cannot choose their journal. They are not in a position to choose in which journal they will submit it. They can work, they can help you, they will do the thesis, everything is okay. But yes, finally, the guide or the mentor, they are supposed to help him or her. This is the first step of their thing, no? So you have to help him. They cannot select it. It's not possible most of the time. So we have to actually help them. Then regarding this NMC criteria, suddenly this NMC has come to our thing, and it has become, it is a real turmoil in our teaching faculty careers. It has made real turmoil. And suddenly they have deleted or omitted some of the journals, and they have brought to us some other journals. I'm sure within a few years, they are going to change these also. I'm sure about that. And they are also, there is something will go behind the screen and something will happen. I'm sure about that. This is not very clear cut or not very, there is something is going on.
They are confused.
Yes, they are not confused. This, do you know that some of this, there are like publishing house who are saying that you give us this amount of money, we will take care of your journal and your everything. Means starting from your ISSN number, starting from your journal indexing, everything will do it for you. This is a matter of 1 or 2 years. We'll do that, but you have to give this much amount of money. And this is a very, very reputed publishing house I'm talking about. I'm getting 2 to 3 such email that is one. So the criteria is means already the whole thing, I think, has been actually snatched, or it has been this corporate house. This corporate house are actually dealing the whole issue. I think some of you can disagree with me, but basically I am thinking about in that? What is my experience in my, I have already 2 to 3 journals I have done attached to.
So ma'am,
Then-
how to run an open access journal? That's another topic to discuss. You're very right. Publishing houses are marketing journals and asking them to pay so that they can run their journals for them. But if the journals, academic journals want to be publishing in a scholarly fashion and not going commercial, then somebody has to pay to run that journal. Either the society that the journal represents, or the authors, or the readers, somebody has to pay, right? So
I know you are in the publishing house, attached to
no, I'm
publishing.
not in a publishing house, ma'am. No, I'm not in a publishing house. I'm
Close to that.
no, not at all. I am not attached
Not
to
at
any
all.
publishing house. So
Okay.
that's why when researchers reach out to us for publication support,
I think
we
this
tell
is
them,
not
we can guide you how to do that, but we cannot guarantee you that this journal will publish your article. We cannot do that. Like any researcher cannot say that if I submit it to a particular journal, this will be accepted. It's not that. We can just do our best to help them select the journal.
Okay, there is one more point. You have already clarified that peer review process. Yes, some of these journals, they say that our peer review process is 6 weeks, 3 months. But this is actually a gray area, what I feel. This is totally a gray area. Some of the journals, they just will not give your answer, and they will almost 1.5 years after that. By the time you are frustrated and you have sent the article to some other journal, and suddenly both the thing has come to you that it has been accepted. This has happened. This has happened.
So before sending it to another journal, you have to withdraw it from the first journal. Ethically, you should withdraw it. You
Because most of the time we think that they have forgotten and they have.
But you have to definitely send the email that.
That is the thing. We have to be careful about, because they can blacklist you otherwise.
That is violation of publication ethics.
Yes. Because when you submit, you given it in writing that you have not submitted to any other journal simultaneously.
It's mandatory.
Yes. But that mistake, many of us actually do that mistake. Our students should not do that mistake. That is our take-home message.
I showed you that example of the NMJA article. It took us 2 years to publish a review article. It wasn't even an original research paper. It was a review article. It took us 2 years to publish because their process of reviewing was taking long. They were not finding suitable reviewers, they said. Right. So sometimes they have a challenge in finding the right reviewers for your topic.
A process of systematic.
What, ma'am, Dr. Shobhusha, yes.
Systematic review process, the peer reviewing takes time.
No, this is not a systematic review. This was a narrative review. But because this was something against, I would believe this was something against the MCI guidelines, they probably wanted to be sure who they want to send it to for review. So that took a long time.
And that's why they also ask for suggestions. If you have anyone in mind, you can suggest reviewer.
But I don't think the publishers or the journal would send to the reviewers that you suggest. If you are suggesting those reviewers, you probably already know those reviewers or have in some way worked
That
with
is
those
correct,
reviewers.
but at times.
No, not
just
always.
increasing their database.
Not always.
Not always.
That is
Not
only to
always.
increase their database. They do that only to
We have
increase their
certain rare
database.
studies, the reviewers also are very rare. So they are not-
Another important thing what ma'am has already told, that is just by looking at the website, we should not take our decision. But in spite of that, when you are going back to the journal indexing in that particular indexing information system, then also you can miss it. I'll tell you examples of this. I sent an article in one journal that was offset in 2019. And this indexing, some of this, they just for 1 year, they just... And when they published it in 2021, by the time they are not indexed in that particular. So even And that the editor or that journal house, they will never inform you that now we are not indexed in the journal. So these are the areas where actually we all are in a soup. If anybody can, Dr. Natasha, these are the things. Means,
Dr. Prafulla, are you there? Dr. Prafulla?
No, you're actually
Yes,
the
sir.
impact.
Yeah,
you're
please,
actually
your
the impact
comments.
factor. You're actually the impact factor ones.
Congratulations, ma'am. The talk was awesome. But I'll say few practical points that I encountered while publishing, since this is largely addressed to our resident. So first of all, never decide the journal where to send your article on your own, because you are not that much experienced enough. So take help from somebody who is doing some work in that field. Okay, and you will definitely find some of your consultant interested in that, because it takes a lot of experience. And second, if you're publishing for the first time in ophthalmology, it's not that difficult nowadays, because you see there are hardly 2 or 3 journals that accept case report. Review article also, there are 3 or 4 dedicated review journals. And for original papers, cataract, you find JCRS. In cornea, there is cornea. For general, you can go to AGO and ophthalmology. But the important point is, at times often we are worried that our work is not that good. So let's send it to some journal with a poor impact factor. And I think ma'am suggested that quite right. Don't be scared about that. And in fact, what at RP Center, what my Dr. Namta or even Dr. Baspe's approach is that if you have done some work, please send it to the best journal first. Why? Because they will do a very good review and they will point out all your lacunas, starting from statistics to everything. Because AGO, for example, they even do the peer review for your statistics also. Somebody is sitting there who is going to cross check your statistics. Once all the reviews that you are got from the journal, then you can correct your manuscript. Okay, and then make a list from this descending order. One this, second this. If that fails, then I'll send this. So we have a list of 6 journals: 1, 2, 3, 4, 5, 6. And if you have done a good job, trust me, it will be published. Just to give you one example, we did a review of acremonium keratitis. We sent it to EIZOC because I thought that it's not that good data and it's largely addressed to Indian audience. So let us send it to EIZOC, but it was rejected. Then we sent it to a better journal with impact factor almost 4 times that of EIZOC. And to my surprise, that got accepted. And the reviewer was like, I'm very happy that you have done this, because the literature doesn't say much about acremonium keratitis. So that's the point. If you have done a good work, one of the chief editor will recognize that. Okay. Yeah. So this is if you are publishing for a passion. But unfortunately, which a lot of panelists were highlighting, nowadays it has become a compulsion. And thanks to the government of India for that, because they are, research may take 5 years, may take 10 years. But because of government guidelines, you have to do 2 good quality research in 1 year. Because I think MCI guidelines suggest you have to have 2 papers per year. So government of India, they themselves want you to do poor quality research so that you can finish it in 1 year and get it published. So if you are publishing it by compulsion, then also I think MCI guideline, it doesn't require all the article to be published in PubMed. If you see the list of MCI approved journals, it's very easy to publish them. And one good trick is just submit it as an open access paper. If you are really in a desperate mode, the moment you pay some amount, most of the journals, they don't refuse it. They will definitely accept that. So that is if you have to address your compulsion part. But if you are passionate about this publishing, then please do good work. Data collection should be meticulous. If your data is strong, even if you are not getting some positive result, or the result may even be negative, still it will be published, because a negative outcome also carries that much importance as a positive outcome carries. So before deciding the journal where you want to submit, please do a good research, collect data properly, do all the things that is required, and then you can plan where to submit. Take help of some expert in this field, because if you try to find out on your own, you will waste a lot of time. And as Rolika and ma'am, they were highlighting that predatory journals, you may got into that trap. So do a good work. If you do a good work, it will be published, no matter which
Yes.
journal is that. And
Right.
last point, impact factor doesn't matter at all. If you publish in IGO or you publish in AGO, in PubMed, if you search, that article will be there. You know, and somebody who is doing a review or who wants to cite, he never thinks that okay, this is published in IGO, so I'll not cite this article. If your work is good, if you're discussing new technique, then that author will definitely take into consideration your article. So most important thing is do a good job. If you have done it, then it doesn't matter which article you are sending. Ultimately, people will appreciate your work.
Right. I agree with Dr. Praful, as he has very rightly said that the journals that we send it to, international journals, they very beautifully comment on your work. So if you really have to believe in your work when you send it across. Don't think that don't underestimate your own work when you send it. For the first time when I sent my article, they'd actually written line so and so, paragraph so and so. This is what you need to work on. So it gives us motivation as well as a direction. So automatically you'll end up liking your own work and you like doing more of it. Don't underestimate your work. And as sir also said that there is no good journal, there is no bad journal. There is a right journal for your work. So what kind of work you're doing, you have to see which journal is doing that kind of work. So you can choose which journal to send it to. Impact factor eventually is important, of course, but it always falls in place. But so you have to focus on, like, if you are writing on Indian population, then your target is Indian population. So your target is IGO. But if you're writing on glaucoma population, then you automatically send it to a journal which works on glaucoma specifically. So that's something that you have to choose. And you have to choose and wisely.
Sarmishta, you want to have some comments?
Can I just
Sir,
add one thing to that?
Yeah.
I'll give you a good example of AIMS faculty interview. The chairman of selection committee, what he was asking to all the candidates was that, tell me the paper, your best paper, which has the highest sample size, not the paper which has the highest impact factor. Okay, so that means your quality of work is more important than the impact factor of the journal where it is published. So do a good work, people will appreciate that.
Yeah, so to add to this also, even if the impact factor of the journal is not high, if your study is good, it will be cited for sure.
Yes.
It will be noticed, it will be cited. And today in the day of internet, it gets noticed somehow or the other. It's not like, people are not receiving that print journal and so therefore not reading it. So it doesn't have a wide distribution. You cannot say that, certain journals do not have wide distribution. All journals are accessible if the correct keywords are being used by the person who's researching.
Absolutely. Yeah.
One more point what I just want to share. Even if your work, target audience is very important. You may not send it to an ophthalmology journal. There are some articles, some message which you can send in an obstetrics journal. In a journal, suppose you are working for a general practitioners. If your data is like that, if your subject is like that, we can always send those type of journal, like in ENT journal, in community medicine journal. So not only ophthalmology, in that way, actually there is a wide field of journals. You can select from those journals also. ENT, community medicine, obstetrics, and dermatological journal, all these things you can also send in those journals also.
So if your article is about sarcoidosis, you may want to send it to an immunology journal. You don't have to stick to an ophthalmology journal. Is what
Yes.
I think that Chaitra, now you have to say something. Now we have a lot of discussion on this topic. Now we could summarize.
Sir, I just want to tell one point,
please.
sir. Sir, just that in our setups, in government setups, we do not have very good documentation, sir. Yes. So our lacuna is the documentation part. Either we do the documentation ourselves to have a good study, that is the sample size, as Dr. Prafulla said, and he covered up most of the topics. Like nowadays we are working because of compulsion, so that passion is reduced, and all the difficulty is there, sir, because of little documentation.
So, ma'am, my suggestion here would be maybe, institutes could have clinical research coordinators, जैसे होते हैं वैसे ही, they could have research coordinators who are not clinical practitioners, but they sit with the clinicians and do the documentation for them.
Yeah,
And
that need to be set up.
yeah, that needs to be set up. But yeah, there are some, I've seen some private practitioners, in fact, ophthalmology private practitioners who have wonderful data collection because they have research coordinators with them. So this was a certain glaucoma specialist I took my dad to, and he actually made my dad fill up a form for around 15 minutes. There were no patients because of which we were waiting. There was no waiting queue. But he made my dad fill up that form, all about his history of glaucoma, whether the doctor who he was consulting before that had told him it was an open angle glaucoma or a closed angle glaucoma. What does he know about his disease? What are the things that he is doing? What are the symptoms at that point of time? So I was just amazed at the amount of data that they were collecting at that point, which was the first visit to that glaucoma specialist. So yeah.
Chaitra, now your comments, Chaitra.
So I think basically to summarize, there's not much because a lot of has been covered. Actually, everything has been covered by Dr. Natasha, and in the discussion, I think personal experience also has been shared. And I think right from youngsters to at a stage where you're publishing review articles, it's never a given that you know which journal, unless and until you are invited by that journal. So then you really that decision is out of your hands when you're an invited author to write a review or a commentary or an editorial. But for everyone else, it is a slew of rejections after one journal after another. But I must tell you, you should never ever be discouraged by it, because eventually you will find that perfect journal, which is the journal that accepts your article. So at a stage when you're still building up your CV, any journal that accepts your article, provided it's not a journal that Dr. Natasha spoke about, where they're just only fleecing you for the money. Any journal that could be a state journal, it could be something that's on PubMed, will be ideal. But even a state journal is good enough because it's just a stepping stone. And eventually you are going to be able to get your paper on PubMed. So I think we've had great pointers from everybody, right from people who are starting off to people who have published, the seasoned, authors. And I think we've had a great session today.
Thank you. Thank you. So, Dr. Santosh, I think before you start, I think I will ask Mr. Kusagara to give his video. Then we'll go to.
I have 2 points to discuss.
Yeah, please. Yeah, carry on first. Yeah.
So you don't allow me to.
No, you are the final comments.
No, I just wanted a clarification from Dr. Natasha regarding, do every one of us need a ORCID ID to be made, or you can go ahead publishing without having one?
It's not a mandatory thing for all journals. Many journals have it as a mandatory requirement, but not all journals at this moment. But I think ultimately that will be the trend, that most journals will ask you for an ORCID ID when you are submitting, because ORCID ID actually helps, gives you an alphanumeric unique ID as a researcher. I'll tell you from my personal experience, there is a certain botany specialist called Natasha Das from West Bengal, who publishes quite frequently, and every now and then I get emails asking whether this is an article that should be connected to my ORCID ID. No, it is not an article. I said that no, this is not what I have written, but she is a prolific researcher. I am not, right? So if somebody is looking for an author called Natasha Das also, even on PubMed, they would be considered.
It's like Aadhaar for publication.
Yeah. It's a unique ID that you have as a researcher.
And I just wanted to know for all of us, preprint and you mentioned regarding preprint journals.
Yeah, so
Can you just clarify?
preprint journals, preprint servers have been there for ages, but with COVID, preprint became more popular because everybody wanted the research to be out there as soon as possible. So they started putting up on preprint. Now, preprint allows other researchers to comment on the article. But earlier, when we were submitting to journals, we had to give in writing that this article has not been published anywhere else. Now, there are some journals which allow you to publish it as a preprint, but you must mention that this is put on certain servers as a preprint, and you have to provide the link to them. And when the article is peer reviewed by that journal and it is finally accepted, you have to then put a link on the preprint server that it is now the final version is available on this website. That's how it works. But preprint is a good thing. I think it brings the research to the public as soon as possible.
Yes. Thank you. Thank you. Sir, you can go ahead.
Now, PubMed also has a preprint database. PubMed preprint database is also there.
Thank you, Dr.
Okay, thank you, madam. So I think Kusagra, will you share the video? I think this is our host
Sure,
video.
okay.
Yeah. Thank you. So again, it's over to Dr. Santosh.
Thank you, sir, for giving me the opportunity to thank everybody here who has really contributed to enhance our knowledge regarding choosing the right journal for publication. I'm starting with the speaker, Dr. Natasha Das, who is very popular now among all of us. And as everybody mentioned, she has flawlessly described everything and cleared all doubts in our mind. And so thanks to all the panelists, Prafulla, Chandana ma'am, Rolika, Dr. Rolika, and our own Dr. Sarmisha Behera and Dr. Puspa Kumari. As usual, the flag bearer being Dr. B.N.R. Subudhi and mentor Dr. Chaitra Jayadev and the chairman scientific committee of EIZOC, Dr. Sabyasachi Patnaik. So it's been a very good journey till now, and we hope definitely it has already shown results in giving more number of publications from our state. And also we have established our journal, the first issue is out. So I thank all of you to be part of this wonderful effort. And last but not the least, Entod for providing the platform. But the bottom line is still, I repeat, I'm still learning. Thank you, one and all.
Thank you very much. I think it's close. And before I think close, I request all of you to submit articles to our journal, as Dr. Santosh already mentioned. This Odisha Journal of Ophthalmology. It's again, we are in the process of indexing. Our first is over and it will be inaugurated in our state conference in the next month, this month. So I invite articles from all of you to this journal. It's a really, I also is a infancy, but it's the process of indexing. It's in infancy. So
it's already a peer review done and getting to be indexed soon.
Yeah,
within next 6 months or 1 year.
Published by the Magno Publishers. So it's one of the best publishers in the country at present. So we invite articles. Thank you very much for joining with us. Good night.
Good night.
Good night.
Night.
Thank you,
Good
everyone.
night.
Good night, everyone.
Thank you.
Thanks.